Functional health reset. That's what we're going to be talking about tonight. So really the purpose behind this webinar is to bring attention to a lot of different things that have play in the functional medicine world, but how your body has this interplay between your gut, your hormones, inflammation all over the place, and really helping you to understand what that looks like, and what different options there are for you guys moving forward. And so we're going to talk about the different IBS pathogens that we're dealing with, talk about how that impacts hormones and digestion and inflammation. And this is definitely an interactive type presentation. So have your chat boxes open at the bottom of the screen. There's an icon typically that talks about your chat. I'll be asking questions. You guys will be able to answer that stuff with me. And we'll sit and chat and go through a lot of this stuff over the next 30 minutes or so, okay? So really we're talking about this triad that I just mentioned of the interplay between your gut, between inflammation and the hormone dysfunction, and how one thing, typically any of those three, can start this cascade, this process of chaos that really happens in your body, and it all feeds off itself, and it creates this ongoing cycle that, unless dealt with in the proper fashion, can really help. Well, it can continue this cycle of ongoing dysfunction in your body. And so one of the things that we really look at is just tell me whether or not this sounds familiar to you. You were probably doing really good until you hit maybe your 35th, your 40th birthday, and then all of a sudden you start to get exhausted, weight gain, mood swings, despite doing everything right. You're eating the right foods, you're exercising, and still nothing is helping anything. The thing that you need to understand is that you're not alone in this process. It's not that you are aging, because you shouldn't be sick just because you're aging. It's not that you're weak or you don't have the willpower to get better. It really is that there are these underlying culprits or bacteria or parasites or other things that are kind of hijacking your body and causing it to go down this path. And the thing to realize is that over 75% of women ages 35 and above are struggling with hormone imbalances. And that's just not me throwing a number out there. There's plenty of research to actually support that. And of that 75%, symptoms continually intensify or get worse. It's over 80% of those people are not improving. And of that group, 85% of them actually have what doctors are classifying as normal labs, right? You go to the doctor, they look at your blood work, they look at everything and say, I don't know what's going on. You look perfectly fine, or everything looks normal. This is all in your head, is quite often something I get told in clinic quite a bit. Um, and the reality is that your hormone disruption isn't because you're getting older. It's not because the kids decided to move out of the house now or go away to college. It's not because you entered perimenopause that this is happening, right? There's this triad that is systemically destroying your hormones. And it is caused from inflammation. It's caused from a lot of different things that are going on inside your body. And so this is where we're going to start some of these interactions and stuff. Which one of these symptoms most resonates with you? Okay. Is it that you're exhausted no matter how much you sleep? Doesn't matter if you go to bed at 9 o'clock and wake up at 8 o'clock and you're getting a full night's sleep, um, but you're still exhausted. Or maybe it's number two, where you have all this excess weight gain around the middle and it won't budge no matter how much you're working out, your calorie deficit. You just continue to gain weight. Or maybe it's number three, where you have PMS from hell. You have these mood swings every month that just continually go on, even after or through perimenopause, where you're still having issues. Um, Jennifer, you're not able to see the slides?
No, I just see like three slides on top of each other.
Okay. Let me see here. I want to make sure. Can everybody else? Oh, yeah. Let me see. I'm going to change my screen here. It's sharing the wrong slate, wrong screen. Give me 1 second here. All right. Is that better?
I don't see anything yet. There we go. Bluegrass Natural Health, I see.
Okay, so now let me put the right slides up here for you. There you go. Is that
Hey,
better?
perfect. All right.
Okay, thank you for telling me that.
Sure thing.
Technology is always fun. Okay, so
Mhm.
of these symptoms, we talked about exhaustion, weight gain, PMS from hell, where everything's moody, right? 1 second you're good, and all of a sudden these little things happen, and it just causes your emotions to go out of control. You end up with these intense mood swings, intense cravings, and they just kind of come out of nowhere. Or maybe it's number four, where you just have a lot of brain fog, right? You walk into a room, you can't remember why you're there. You have this conversation intense with somebody last week, and you can't remember it, or even that you saw them last week, and you just kind of feel stupid through the whole process. Or maybe it's low libido, or you just feel disconnected from your body. If any one of those, or if all of them, type it into the chat, and let's see what are the most common things that we tend to see with this group here. I see that, Alicia. Thank you. So brain fog seems to be the number one thing that I'm seeing over in the chat. Okay, so let's talk about that a little bit more here. Okay. So these are some things that your doctor has never really told you, okay? That it's this combination of your gut, your inflammation, and your hormones, the gut dysfunction, where you have these pathogens that tend to create systemic inflammation, whether it's the neurotoxins that they're putting off, whether it is the fact that they are inhibiting your body's ability to break down different vitamins and minerals or amino acids and proteins, whether it is your body's inhibition of the digestive enzymes, which then inhibits your absorption of different things. Okay, so that's one possibility of things that are causing problems. Another thing is chronic inflammation. And that inflammation doesn't really just happen like in your ankles or in your wrists. A lot of people describe it as my whole body just feels inflamed. But one of the things you have to remember is your body works at a cellular level. And so, really, you get this cell, and the cell wall itself, the outside of it has all these receptor sites. And that's how all the vitamins and minerals and hormones and everything get in and out of the cell. And then all the work happens on the inside. Well, when you have that chronic inflammation, all those receptor sites on the outside of the cell, they don't work. And so the cells inside, number one, you're not able to get all those nutrients into the cell so that you actually are functioning at a high level or an optimal level. But the other part is the inside of the cell can't let the toxins out either. And so the cell really isn't working at a very efficient um, level to where you are feeling really good. Outside of just the body feeling inflamed, it's also that inflammation that happens that you can't see inside the cell. Okay. And then also, it could be that the hormones are being hijacked. And that is because of inflammation as well. So there's a lot of different things that we have to pay attention to, a lot of different things that um, take part in this process. And what we have to realize is that you can't fix your hormones without fixing your gut and inflammation at the same time. It really is um, this triad that needs to all be addressed at the same time. And so let's talk a little bit about what is triggering your triad of chaos, okay? And again, we're going to be using the chat box here, but maybe you have a medical history where you've taken a bunch of birth controls when you were younger, and that in itself can change your hormones and how they all function. Maybe you were exposed to antibiotics multiple times. Sometimes you hear of people taking antibiotics for an ear infection, and that ear infection just wouldn't go away. And so they took 3, 4, 5 rounds of antibiotics. Or maybe you were just really sick as a kid all the time and you always had antibiotics on board, or you were taking them multiple times a year. Also, maybe you're somebody who is exposed to chronic stress. You have a really high demanding job, you have a sick family member that you're trying to take care of. And so there's constant stress in your life that is also wreaking havoc on your body. That's number one. Maybe number two, you have digestive issues where um, you're bloated, you're constipated. You eat something on one day and it causes inflammation, but you eat it 2 weeks later and it doesn't do anything. And then you have it a third time and all of a sudden it's back to causing problems. So you have all these digestive issues, or maybe it's the other way around where you can't, your stools are just so watery, so loose, right? For some people, they have more of a chronic symptom, right? They're fatigue, joint pain, they have autoimmune issues like thyroid issues, and other stuff going on that is constantly causing inflammation in their body. Or maybe it's number four, where you're part of it. You've been in a toxic relationship. You've had the death of a loved one. You're caring for, older parents, or maybe even a sick child. And then maybe number five, it's an environment that you live in. Maybe you are in a home that you can see mold growing on the walls or in the ceiling, and you're constantly being exposed to that. Maybe you just are working in an area that has a lot of chemical exposures. Had somebody come in one time and they worked for the Toyota plant, and their whole job was spraying chemicals onto the metal so that it was more pliable in the process of making the cars. And they were inhaling these chemicals constantly throughout their job. If any of those kind of jump out at you as being possible triggers for you, go ahead and type those over into the chat box as well right now. Okay, so a lot of different triggers for you guys. Okay, so let's talk a little bit about the cascade that happens. Okay, we tend to get this triggering event, something that changes our body. The antibiotics can change your whole gut microbiome. You have stress that can change your microbiome because an influx of cortisol, or the toxins can do that as well, or a trauma that causes cortisol stress, and that changes your microbiome. It changes the inflammation that hormones are causing. And all of this leads to a gut barrier breakdown. So a lot of people, you hear the words leaky gut or pathogen overgrowth. And so, that breakdown of the intestinal lining, that really is where your body is interacting with the world. And so when we hear the words leaky gut, we have to think of what in your body is actually causing that to happen, whether it's a food sensitivity, whether it's an imbalance in the microbiome, whether you have some kind of pathogen that's actually eating away at the lining of your gut. Those are all different things that can cause this cascade to progress. And then as that lining of your intestinal tract that separates you from the outside world breaks down, you tend to absorb a lot of things into your body that shouldn't be there. The bacteria release things called lipopolysaccharides, which are toxic to your body. Maybe you're absorbing actual food particles into the bloodstream. Those become inflammatory as well because you're not supposed to absorb food. You're supposed to absorb the nutrients of the food. And so all these different problems cause chronic inflammation, and that churns on your immune system and creates this high alert type system that's going on. Or maybe it's that just that inflammation itself can lead to hormone disruption because that inflammation is going to, like we talked about earlier, block those receptor sites, and it also can impair production. Like a Candida overgrowth will impair your body's ability to synthesize or utilize and break down estrogens well. Okay, and so you end up with this estrogen dominance. Or then maybe you just have this full-on explosion of symptoms where you've gained weight, you're tired all the time, you're moody, and it just causes this inflammatory cascade to continue, causes the bacteria to grow. And the thing that you need to understand is that your body is stuck in an inflammatory cycle. And conventional medicine really is only looking at treating your symptoms rather than the actual root cause. And so they give you like an autoimmune medication or an anti-inflammatory medication, when really they should be treating microbial overgrowth or parasites, or they should be looking more for a root cause rather than what is going on with the symptoms that you're actually feeling. Okay, so where do you guys tend to feel your symptoms the most? This kind of tells us where the inflammatory process is in your body. Is it in your head? Meaning, do you have headaches, mood swings, brain fog? If that's you, go ahead and place a 1 into the chat. If you're somebody who experiences a lot of these symptoms in your chest, where you get anxiety or heart palpitations, or maybe you have a hard time breathing from time to time, or you become short of breath after you walk up a flight of stairs, that tends to be a lot of inflammation in your chest. Whether you're having arrhythmias or something like that, it's inflammation in your heart, right? Maybe it's an abdominal issue where you're getting bloated, digestive issues, weight gain. There was some research put out about gluten several years back that people who eat gluten, only about 10% of the population, well, let me take a step back. 70% of the US population has a sensitivity to gluten, meaning bread, bagels, donuts, muffins, pasta, cereal, you name it. 70% of the US population has an issue with gluten. Only 10% of the population actually has a problem in their digestive tract. So that means the other 90% of those people actually have problems with their digestion, or they have problems outside their body. So only 10% are actually having digestive issues with weight gain, digestive pain, bloating, cramping, constipation, heartburn, reflux. So all those different things. It's only a small population. Now, maybe you're somebody who has pelvic issues, where maybe you have pelvic floor dysfunction, maybe you have painful periods, cramping, or bladder issues can even be part of it. So if the pelvic region is more of where you're having your symptoms, go ahead and type a 4. And then if you are somebody who has joint pain, muscle stiffness, aches, if you are getting, uh, you know, arthritis prematurely, if you have autoimmune symptoms that just make it hard to move, then go ahead and type a 5 down in the chat there. Okay. And so, you know, it doesn't have to be any one or the other. You can have multiple symptoms. Your body can be totally inflamed that you're getting headaches and abdominal pain at the same time. It doesn't have to be just one, it can be several. And so really this is kind of giving us an idea of where your body is hitting the hardest. Okay. And so let's talk a little bit about how inflammation steals your hormones. Okay. So insulin resistance is going to be one of the biggest things when it comes to inflammation. Remember, we talked about how the cell wall is working, and really the cell wall is in charge of your blood sugar regulation. Now, there's a lot to it. People can have problems with their pancreas and the production of insulin as well. But when it comes to insulin resistance, one of the biggest issues we see is how well the cell wall is working. And so when there's inflammation that's bogging down that cell wall, it inhibits the ability of insulin, which is the main peptide that causes your blood sugar to be regulated. That insulin is no longer allowed to go back and forth across the cell. And so that triggers sugar cravings, it triggers weight gain, it triggers a lot of inflammatory processes because your blood sugar is higher than it should be. Okay. Then we look at thyroid suppression. Okay. When you have a lot of inflammation going through your gut, you tend to develop a lot of cytokines. Now, cytokines are kind of like the text messenger in your body, right? As um, as you're exposed to things outside of what your body normally should be exposed to, your body creates cytokines and it says, really, go attack this. You need to be inflamed because I've got this thing coming in that's not supposed to be here. It's a foreign invader. Go attack it. And it really triggers your immune system on. Also, you have cytokines that suppress immune function when things are good. So when you have this inflammatory process going on, cytokines tend to take off. And we learned a lot about cytokines over COVID, when COVID really became big 5, 6 years ago now. And everybody was talking about cytokine storms because there were so much of an inflammatory response to the COVID virus that now we also know cytokines are very active with a lot of other disease processes. And so they can trigger fatigue or metabolic crashes, and they inhibit how your thyroid is working. Your thyroid is really the canary in the cage. When it comes to how your body works, your thyroid is going to get affected the soonest. And so really we pay attention to your thyroid quite a bit when we're looking for inflammation and autoimmune issues. Okay. That inflammation is also, it's going to cause your body's cortisol response to elevate. And it does that because really it's putting your body into a fight or flight state. And so cortisol really is going to be pumped into your body to try and protect you from whatever is causing this inflammation. And so that elevated cortisol is going to mess with your hormones because it blocks progesterone. And then you become even more estrogen dominant. And so you start having a lot of symptoms with estrogen dominant. Things like weight gain and brain fog are key things when it comes to that. And so, and then you also have things because of testosterone imbalances due to the excess estrogens. You get this backup of testosterone that causes hair loss where you don't want it, and hair gain where, wait, other way around. Hair loss where you do want it, hair gain where you don't want it. So like your arms, chest, you tend to get weight gain, or you tend to get hair growth, but on top of your head, you tend to lose it. So that's another one of those issues that we have due to inflammation. And then the estrogen dominance, because those detox pathways, the methylation stages of getting rid of your estrogens tend to get clogged through either phase one or phase two. And so you can end up with cancers, with heart disease, PMS, heavy periods, all because your estrogens are out of balance. And so it really makes you to feel like you're a stranger in your own body, even though everything looks normal on your labs. Okay. And so, um, going to go through a couple things here about your digestion and your gut, and tell me if either of these really resonate with you. I'm going to take the slide backwards, but generally healthy people are over here in number three. And those are people who you really don't have any symptoms. You guys wouldn't be here today if you were a number three, right? Generally healthy. Your bowels are comfortable. You don't have any dysregulation in your gut at all. That would be a general healthy person. Number two would be somebody who's inconsistent with their gut. Sometimes they have heartburn, sometimes they don't. Sometimes they feel really bloated, sometimes they don't. Sometimes they can eat a great meal and nothing happens. Next week they have the same meal and it's all hell breaks loose kind of thing, right? And then some people, it's just constant. From the second they wake up in the morning till the end of the day, their belly just continually gets bigger and bigger and bigger until 5 o'clock. They feel like they're pregnant. That's more of the constant bloating, pain, irregular bowel movement type issues. Okay. So if that's you, if you're one or two, your gut dysfunction is likely driving everything else that's going on in your body, your hormone chaos, the inflammation. And when it's compromised, it becomes a breeding ground for these hormone and IBS hijacking type pathogens. And so we're going to be talking about those here in just a second, okay? But really, we talk about this cycle again. Gut dysfunction or pathogen overgrowth begins. It leads to infections where these infections release different toxins into your body. All these inflammatory compounds then cause hormone disruption, which creates more gut dysfunction. And then that gut dysfunction then creates a chronic inflammatory response, and everything kind of gets blocked up. Your hormones don't work as well anymore. And then that leads back into the gut dysfunction. It just kind of feeds it over and over again. And so that's really the path that all this stuff takes and how it really ends up affecting your body. So let's talk a little bit about what those different pathogens are and what they're doing. Okay. So the most common ones that we deal with on a regular basis, first one is Candida, and he feeds on your estrogen. And so when you have Candida, it's going to block the metabolism of those estrogens, and your body's just going to continue to build them more and more and more, and it creates this dominant type environment where you're not able to eliminate, and the Candida causes estrogens to just back up. Okay. The second one is SIBO, or small intestine bacterial overgrowth. And this really is a production of inflammatory endotoxins in your body. And what it is really is most of the bacteria in your bowel lives in the large intestine, okay, the end part of your bowel. The small intestine, which sits between your stomach and your large intestine, doesn't have a lot of bacteria in it. And so what ends up happening is bacteria ends up getting up into the small intestine through what's called the ileocecal valve. And when it sets up camp there in the small intestine, your small intestine isn't capable of bloating and getting larger like the large intestine is. And what ends up happening is you end up eating food. The food gets broken down into sugars. The sugars feed the bacteria, and then your stomach just starts to bloat and get bigger, and it can cause an off-gassing of different gases like methane and hydrogen, and it causes a lot of pain. It causes your bowel to slow down or speed up depending on which bacteria get in there. And that bacteria really isn't supposed to belong in the small intestine. It's supposed to live in the large intestine, but then it gets out of control. That's what small intestine bacterial overgrowth is. Then we talk about parasites. Now, parasites are notorious for hiding. They're notorious for stealing all your nutrients and your hormones, and they tend to live in the small intestine as well. Now, a lot of people think parasites are a faux pas. In my line of work, I see them constantly. Um, I don't see it as much in the stool samples that we do, although we do a lot of stool testing to look for them. Where we typically see the parasites is in your blood work. And not that we're actually seeing strands of parasites or worms in the blood, we're seeing evidence of them in the different markers that we're looking at. So quite often parasites are going to be something that we see when number one, all your vitamins and minerals are out of balance or you're deficient in everything. We look at your white blood cells. There's several different types of white blood cells, and certain ones will tell us whether or not parasites are active in your body. And so there we look for different parameters like that. But parasites, when they live in the small intestine, um, they are feeding off the nutrients that you are taking in directly. They are really going to be uh, getting first dibs at everything you eat. And so I quite often will get people coming in saying, I started eating super healthy. I'm eating everything organic. My meats are all grass fed or wild caught, and I'm feeling worse than ever. And I look at their blood work and I talk to them about it's most likely going to be parasites. And they're like, but I've been eating so healthy. The parasites have been eating healthy also. I hate to break it to you, but they love all the high quality food that you're eating. It just causes them to thrive even more, right? Because they're getting the high quality stuff. And then the last thing is H. pylori. Now, this is a bacteria that we hear a lot about because a lot of people have H. pylori type overgrowths in your stomach. H. pylori, it does a couple of things. Number one is it disrupts the stomach acid uh, and it causes a change in the pH balance of your gut. And that causes a lot of other issues down the road. But let's talk about Candida a little bit more detailed here. So it has its own estrogen receptors, and so it can feed off of your hormones. It also has a toxic byproduct that can block your liver detox pathways. It blocks the digestion and metabolism of those estrogens. And then it thrives on sugars and it creates an unstoppable sugar craving. Um, quite often our behaviors and the things that we want to do and the things that we eat are actually driven by the bugs that are in us. So when you have a Candida overgrowth, it's quite often that you do crave sugars because Candida loves sugar and it helps it to thrive and it helps it to live better. Okay. The results of it, though, because of this estrogen dominance, is you have heavier periods. Your PMSing is more severe. You tend to have, because of the excess estrogen, you also have breast tenderness, you have weight gain around your hips and thighs. Candida can also cause recurrent yeast infections, whether it's in your mouth, you see white buildup around the vaginal folds, you could see it in your armpits or under your breasts. And then you also can get a white coating on your tongue. And thing that we think about with Candida is that it's hard to eliminate, right? It forms this protective biofilm and it becomes resistant to standard antifungals. So your doc may come and he says, okay, we want to use nystatin on it. We want to use uh, some kind of fluconazole or some kind of other antifungal medication, but it's not as beneficial for you because of those biofilms. You really have to be taking biofilm disruptors with whatever you're doing in order to get rid of it. Okay. Second thing looking at is SIBO. So this releases, we talked about it earlier, lipopolysaccharides into the bloodstream. Those are the endotoxins that these bacteria create. And that's going to directly suppress your thyroid. It can directly suppress the cell function. And so you develop insulin resistance. And then a lot of the bacteria can produce methane, which slows your metabolism. They can also produce hydrogen, which increases metabolism, and that can cause loose stools as well. And because of that, you end up becoming really fatigued, or you get unexplained weight gain because of all these extra toxins that are just sitting in your gut. and then getting absorbed into the rest of your body. And as they get absorbed, you develop brain fog, you develop bloating. And think if your stool transit is too slow, all the toxins, because your bowel is one of the main ways you get rid of toxins. And if your stool transit slows down, now you have all these toxins in your body for even longer. If your bowel speeds up, you're not giving your body enough time to absorb the nutrients. So really having SIBO is going to cause a lot of different issues. And this one's hard to eliminate because it hides in the small intestine where most treatments really aren't going to treat it effectively. Okay. The small intestine is a hard place to treat different bacteria, viruses, and everything else. The third thing we're talking about is parasites. Remember, these guys are the nutrient thieves. They get first access to all your food and all your nutrients, but at the same time, it's hard to identify them. And so they steal your vitamins, your magnesium, your iron, your minerals. They also release ammonia into your bloodstream. They're constantly eating holes through your body to nurture themselves, to leach on to different things. And those different chemicals, the ammonia releasing, causes or triggers autoimmune responses. It's going to disrupt your sleep because your cortisol's all out of balance. And the result is that you have either a nutrient deficiency because they got to your nutrients first. You can have fatigue, hair loss because you don't have the nutrients you need. Can create irregular cycles because of all the toxic damage, because of the vitamin imbalance. You're not able to make hormones now. And then you have autoimmune thyroid disease, other autoimmune issues. And then a lot of people can get it, an itchy anus with it as well. So that's just something to consider if you have noticed that. There's different types of parasites. Some like to hang out around the anus, some are up in the small intestine, but that can be a key indicator that you actually have parasitic activity. And they're hard to eliminate because they're masters of hiding, right? We talked about that a second ago, and they have really complex life cycles. So really we're looking at giving certain antiparasitics at certain times with different biofilm disruptors to make sure that we're actually cleaning everything out effectively. And then H. pylori. This is the acid blocker. So if you picture your stomach, if you've ever seen pictures of it, there's a lot of different folds and intricacies on the inside of the stomach. And what H. pylori does is it tends to hide deep within those folds, and it creates almost like this little colony for itself when it blocks out your stomach acid, and it tends to grow. And as it grows, it is going to stop the production of stomach acid, number one, but it also changes the pH balance in your stomach and in your gut uh, going downstream. Because remember, you have several feet, 20 plus feet of intestinal tract between your stomach and the outside of your body. And so as your body, um, as the stomach acids and food travel through the intestinal tract, um, the pH of it is going to change, and that changes what bacteria live or die, or if you have any of the opportunistic, meaning the bad bacteria in there, they're going to start to grow because of the change in pH, where the good ones are going to grow at a healthy pH. And so really we look at H. pylori as, causes and blocks absorption of different things because of stomach acid. It also disrupts protein digestion, so you don't break proteins down into amino acids. And so now your immune system's not working. You don't have the building blocks to rebuild and repair. And then it creates this chronic inflammation. And so quite often with H. pylori, you end up having malnutrition. You become anemic with certain things like B12, low stomach acid. Um, and then you end up also with heartburn or reflux because your stomach needs to be super acidic in order for the valve at the top of your stomach to close. If it's not tight enough, or if your stomach's not acidic enough, then that valve at the top of your stomach opens up, and that allows heartburn and reflux to happen. Okay. And then because you don't have the right amino acids, you're not building muscle effectively. And this guy's really hard to eliminate. I talked about it a second ago because he burrows deep into your stomach lining and he creates these pockets of protection around him. Okay. So just hearing that, what typically, or what do you guys think is your number one issue? Go ahead and type that into the chat. Is it Candida? Is it SIBO, parasites, H. pylori, or maybe you have multiple different things here. Typically, we don't see just one. Quite often, we see multiple at the same time. So do any of these ring a bell? Do you have multiple pathogens going on inside you right now? Okay, I see that, Alicia. Thank you, Kathleen. D for sure. Yeah, a lot of people with heartburn. You can uh, definitely feel that one on a daily basis, right? And so, because you have multiple things going on, it's really you need a comprehensive elimination process rather than just treating one thing at a time. And doing it in the right order is going to be really advantageous in the effectiveness for your treatment. Okay. So again, 75% of women have hormone imbalances, have undiagnosed gut infections that create chronic inflammation, right? The pathogens aren't just causing digestive symptoms. They really are systemically hijacking your hormones through the inflammatory process. Okay. And so this is where the medicine and your traditional doctors um, are going to really miss the mark when it comes to treating all these different issues, right? They think you're okay, they think you're fine, or they send you off to somebody else, right? You go to the primary care, they look at the inflammatory markers, or they completely miss the inflammatory markers. There's quite a few that we use in functional medicine to say, oh, this is definitely a marker for inflammation, where your traditional doctor isn't going to look at it. For example, your ferritin level, which is an iron level, tells us if you're anemic or not. Depending on whether that's high or low, we can determine based on some other ratios whether you have inflammation going on inside your body. Most traditional doctors will use your CRP, your C-reactive protein. And that's a great systemic marker, but it changes really quick. So it's not exactly the most accurate when it comes to marking inflammation. So things like that, your primary doctors can miss very easily. Or maybe they just don't know what's going on. So they send you, you're having mood swings, they send you to the gynecologist to check out your hormones and see what's going on there. And then they are missing the inflammation, they're missing the gut. And so they really don't understand from their perspective, everything looks good too. Or maybe your primary doc, you're having some GI symptoms, bloating, and so they send you to a gastroenterologist, a gut doctor. And he looks at your symptoms and says, oh, you have IBS. We can't do anything for it. Here's something to either slow down your bowel, speed up your bowel, maybe help it so you're not constipated as much, but they're not really treating the underlying cause of everything. So really, medicine tends to miss a lot of what's going on, and it's not really their fault. I don't blame them because they haven't been trained in the functional testing that we do in functional medicine. For the most part, they treat disease and they don't see disease, where functional medicine does a lot to treat dysfunction. And so that's where we're going to really differ between our treatment practices and protocols. Okay. So they're not really looking in the right spot. They look at looking their blood work for inflammatory levels. They're um, and really, there's a lot more to it than just a CRP. They don't do anything to look at your gut for the most part. Even your GI doctors, most of them are going to run something to look for a couple key pathogens, maybe E. coli if you have diarrhea, or they might look for C. diff if you've got a lot of gas or bloating and diarrhea. They might look at your calprotectin, which is an inflammatory marker that your gut creates. But that is really all they do. Whereas in functional medicine or comprehensive gut analysis, we're looking at well over 100 different markers to identify what is the root cause of your gut dysbiosis. When we're looking at hormone metabolites and ratios, we're not looking at just your estrogen, testosterone, and progesterone. We're looking at the pathways that those different hormones are taking to see, do you have backup in the different processes? We're looking at phase 1, 2, and 3 of methylation to see how your estrogens are being broken down. Are they going down clean pathways or dirty pathways? Or do you have the ability to methylate those and eliminate them? And really, we're identifying what root cause connection happens between all three systems. And really, it's like trying to solve a puzzle um, with all this stuff where your traditional doctors may only have one piece of it, right? They're not doing a whole lot to communicate with each other or to work together to really identify what your root cause is. And so, really, if you've gone to a doctor and they don't take you seriously, maybe, or they dismiss you when you've described how terrible you feel, or maybe they've just told you that your labs are normal when you feel awful. Um, or maybe you just feel like you're losing your mind because nobody understands. If any of those describe you right now, go ahead and put that into the chat. And the thing to remember is that your symptoms are real. The triad of chaos is real. And, you're not alone in this process, right? This is something that several millions of people are dealing with, both men and women, um, of all ages as well. So there is a solution to the problem. That's something you really need to understand and remember. So what we're going to do here is I'm going to go ahead and place a uh, uh, link into the chat, and we're going to go ahead and we're going to start taking an assessment test here. Um, Let me just copy it here. And what I want you to do is I'm going to have you go ahead and click on that link. And in that link, it's going to take you to a screen that looks like this. This is the main login page. You guys haven't been here before. Maybe some of you guys have. I think, Leslie, you've been there before. But this is something that I've been putting together over the last several years. A lot of different assessments that I'm rolling out into my clinic on a regular basis now. But if you click on this button at the very bottom where it says sign up, it's going to ask you to enter some information. There's going to be one key spot in the top right corner of that is asking for your sex, male or female. Make sure you click the appropriate one for you. And it's going to bring up another screen that's going to look like this. Okay. Now, what I want you to do with this is I want you to take, these are the different assessments that I've been working on that we're going to be going through today. We're only going to do the inflammation one right now, but it's over here on the left side of your screen when you get there. I want you to click on take the assessment right here. Or it might just say start because you guys haven't done it before. I want you to go ahead and click on that. It'll take you about 5 minutes or so to complete the assessment, but we're going to talk about the results that you guys get. What are the different processes of fixing that, of finding a treatment for you, and what that overall can look like as far as your inflammatory process and how it's contributing to everything. So go ahead and get started on that. When you guys are done, it's going to give you a score that's going to look like this. Okay. I want you to take this top score, the global score, and go ahead and post it into the chat for me. That'll give me a good idea that you guys are uh, done with the assessment and that you guys are ready to go. Okay. And we'll start breaking things down after we get to that point.
Yeah.
Okay. Well, I'm going to go ahead and I'm going to jump into a couple things here. We're going to talk about these scores. Um, Really, when you're looking at your scores, uh, really we're kind of trying to gauge where your inflammation is at, right? For some of you guys, you guys are doing pretty good. Some 47s, 43s. Don't know where you guys started, where you guys have been, and what you guys have been doing to get to this point. For some of you, I do. I have working relationships with you guys, and so I've seen improvements over the months that we've been working together. So we don't know exactly where that's at. I know, Jennifer, we just scheduled your consult earlier today coming in. So, we've got, different people at different places. And really the score shows us how much damage really this triad, this chaotic system in your body is been, or how much chaos has been happening to the different parts of your body, right? And so really we did the initial inflammation assessment today, but really if we want to get a full picture of everything that's going on, we're looking at the inflammation assessment, plus we're looking at the hormones, plus we're looking at your gut assessment. And you can see when you first logged in, there's several different assessments there. And those are utilized at different points throughout my treatments that I'm using now. And so really in order to get a full picture of everything, we really do all of them all together. And so we can identify what's going on with your body. And these assessments can be designed as a standalone for your treatment. They are, and I'm going to break off here and I'm going to show you. Let me go into my patient side here. Um, when we do the inflammation assessment, it's going to give you a whole list. I did this one and I just really revved up the points on there. I got a 224 for those of you guys, so don't feel bad about your 81, Leslie. But I got I did this so you can see that there are a lot of different supplements here. And based on your score, the way this is set up is to give you an idea of what other supplements would be beneficial for you to be taking specifically. Not everybody wants to do a one-on-one consultation with me. And so, some people just they want to try and figure it out themselves. And these assessments are a tool to help you along with that. For those of you who don't have a ton of inflammation, it's for sure going to tell you to be on a wellness foundation pack. For some of you guys who have a little bit more inflammation going on, depending on what's going on with your body, it might make recommendations like doing methyl X, which is there for histamine support, for uh, giving you extra methylated vitamins that can help with the absorption of different nutrients, or maybe it wants to give you glutathione. It's the master antioxidant to where if you have a lot of inflammation going on, glutathione is going to help to detox your liver, detox your body to get your body working better again. Okay. And so depending on how toxic your body is, how inflamed your body is, the program is designed to give you certain ones that are going to help get you to the next level of health. Now, it's not intended to be a standalone. For somebody who has a lot of issues going on, who has a higher score, one-on-one consultation is definitely a recommendation because we want to get you to the next step rather than having to guess on what to take here. Okay. But they give you recommendations, and you can see that at the end of your test as well. It'll give you specific recommendations. Maybe it was ProBio Plus for you, Jennifer or Alicia, because your scores are more towards the mild to medium or mild to moderate side as far as what your toxic load looks like. Okay. But those are definitely pieces of this to pay attention to and really understanding the full concept. So quite often I say, okay, we got to do some blood work. We want to do a stool analysis just to get started and see where things are at because you can't do a proper treatment with just one bit of information, right? We said that's what traditional doctors do, and that's why they quite often miss things, was because they are missing a lot of key points here. And so, why does this matter? Um, we've talked about where you've been. I want to talk about where you want to be, right? If you want stable energy, go ahead and type a one into the chat. If you want to lose weight, type a two into the chat. If it's mental clarity, you just want to be able to think crystal clear. You want to go into conversations remembering what you said the last time you guys met, or maybe that mental clarity has to do with your work performance, right? You're not able to complete tasks well because you forgot what you were supposed to be doing. Or maybe it's that you have painful cycles, and you just want to have an easier period where you're not going through a super tampon every 30 minutes kind of thing, and you want to work on your hormones a little bit better. Or maybe you just want to feel vibrant again in your own skin, confident in your own body. And the thing to remember, it's not just possible, it's very probable when you are addressing everything all at once. Okay. And so, for those of you who are already in my clinic, who I am seeing as patients, this part doesn't really, it doesn't apply to you as much. You are still more than welcome to go through this program. I kind of guide you through this program as we go through everything. But this is kind of the process that we go through, where in the first month, we're really trying to establish a pattern of health. We're trying to get rid of inflammation. We're trying to reduce stress and replace the nutrients and stuff that your body is suffering from depletion. The second month is really about putting out the fire, calming down the inflammation, working on gut barrier, rebalancing stress in your body. And then really in the third month, we uh, start eliminating the pathogens that are causing everything, whether it's parasites or funguses or antimicrobials that are needed. These are the different things that we start to do around the third month of treatment. In the fourth month of treatment is really targeting hormones and looking at optimizing how your body is um, balancing those hormones, eliminating toxins from your liver, and starting to get the different parts of your body that have been struggling, like your adrenals with fatigue or your thyroid with metabolism, hair loss, dry, brittle nails, those kinds of things. Start to restore that stuff. Month five is rebuilding your microbiome, giving you beneficial bacteria, making sure your diet is optimized. We're going to work on that in the very beginning with month one, but really we're working on rebalancing your gut flora even more in month five. And the month six is really looking at long-term wellness, integrating different protocols that are going to push your body towards optimization and preventative stuff. So you can go out to dinner and not worry necessarily about what you're going to eat because number one, you've been educated on how your body's going to work well, number one, but number two, you've got a little bit of resilience there so you don't eat something wrong and all of a sudden all hell breaks loose. You're able to recover quickly, your body's able to sustain through those tiny little instances. And that's really what, the program that I have is all built around. Now, this is a self-directed program that I'm talking about this month 1 through 6. But if you really want, and I get great responses with the clients I have who do this 6 month program. Some of them take a little bit longer than 6 months, but they still get great results out of this. Um, it's not for everybody. Some people want their hand held through the process. And so that's something really to understand as well is that the 6 month program isn't for everybody. The one-on-one consults and actual testing that we do with functional testing is another route to go. And that's something that if you want, we can talk about as well, where uh, we do the functional testing. We talk about those tests in depth. We meet for hours, an hour, at least a minimum of an hour every month to go through the different protocols that you're going through, and to really help you get your body back, get everything under control. So that's more of a handheld thing. But this 6 month program is something that's really designed to do if you want to try and take care of your body by yourself without the high cost of testing, without the high cost of one-on-one consultations. This is also there for you. Okay. And so I ask you, are you guys ready, or what is your level of readiness? Are you somebody are you at your breaking point and you just need to get the treatment? Or, are you desperate? Are you ready and committed to doing the work? Or are you still somebody that's unsure, right? Where are you at in the process? For somebody who's been dealing with this for years and years and is just struggling at every turn, they are desperate to find an answer. And, we're here to help you with that. We know the struggles that you're going through. We do these all the time. Um, Maybe you just want to jump on board and get started with a one-on-one. Maybe you want to get started with the self-directed program. Either way, we're here ready for you and we're here to help with all of that stuff. Okay. So the complete triad or the self-directed program, really it's here. It's a $99 a month subscription, but it's more of an investment in your own health. Okay. This is really you get all the different assessments, plus there's multiple extra ones that you have there. That's customized supplement protocols based off of the scores that you have, which are very comparable to what you're going to get one-on-one, except we're using your assessment scores instead of actual test scores. And then monthly progress reviews. We meet, have a quick 15-minute phone call or a quick 15-minute Zoom call to go over, hey, how are you doing right now? What is it that you're struggling with? And then it's a phase-by-phase elimination guide. So what's included with it is really these 72 videos that I've put together. The videos are short. They're 5 to 7 minutes long. You get 3 a week, and they coach you through the process of what everything looks like. What are you supposed to be doing this week? What are you supposed to be looking for? What assessments are you supposed to be taking? And really, they help guide you through that process. I have weekly education classes every Thursday night that are Q&As that you can join and ask questions about your own progress, or maybe you're struggling with something. That's what those are intended for. We've got monthly group calls like this one, where you're more than welcome to jump on it as well and ask questions. And then there's also the private community. I'm going to place a link for the private community into the chat right now. But what the private community is aimed at is, helping you to understand that you're not alone. Like you are part of a community that is struggling just as you are. And, we want you to feel supported in that community. I have regular postings, tips and tricks, recipes, blog posts, articles, different things to help you on your journey. And that really is a $99 a month investment. Don't think of it as a subscription, but it's really an investment in your health Because if you're not getting better, the chances are is that you're actually getting worse and you're actually spending more than that on your own health and getting nowhere with it. Okay. So that's something to consider as well. Also, if you've taken the time to be here today, really to join us and to try and figure out what's going on with you, I want to help you with that. And so really I'm discounting 50% off of that first month. And I'm going to put a link here. And if this is something that you wanted to get started with, you want to move forward with, I'm going to go ahead and put a chat in here or a link into the chat that really is designed to help get you started. Um, I want you to get better. I want to, be part of your wellness journey. And so, starting this today, being decisive, um, and making a good choice up front, I want to reward that and give you a discount. It's normally something I don't do for just anybody who I'm talking to on a regular basis, but you're taking the time to be here and you're taking that step, and that deserves to be rewarded. So that link is in the chat there. And so this, as a reminder, what you're getting when you start immediately, you have the women's hormone assessments, the gut pathogen assessment. You've got access to the full 6-month program where you get all those videos. You've got an onboarding call with me where we're going to chat. I'm going to walk you through everything. You've got access to the private community, the monthly group calls, and really $47 is like going to Starbucks a couple of times, which I'm sure many of you guys are throughout the week going to Starbucks, um, where you can make the investment now and get started in your health. There's no stress about it. You can cancel anytime if it's something you don't want. This is one of my patients. Her name is Debbie. I got her permission to show this stuff. She sent me the pictures herself. She's 50 years old. She's a business owner, mother of two. Um, and really, she was struggling with a lot of these things. She had her inflammation score wasn't horribly high. It was at 68. Her exhaustion by 2 p.m. daily. She was gaining weight despite clean eating. Her PMS symptoms were super bad, a lot of brain fog. And her labs, she came to me bringing her labs and said, my doctor said they look normal. And she handed me her labs. After 6 months of going through this program with her, inflammation score dropped to almost nothing. She had energy all day long. She lost a bunch of weight, pain-free cycles, her mood stabilized, and she was able to think clearly, which really helped her business thrive. And now all her biomarkers are optimal. And what we found with her is she had chronic parasites, and she also had Candida and SIBO on top of it. So her estrogen was out of control because of the Candida. The SIBO blocked her body's ability to detox. She had a ton of inflammation because of the parasites and also a lot of nutrient deficiencies because of those as well. So you can see what is possible when you actually get rid of all the different issues going on inside your body. Okay, so the cost of waiting really is the inflammatory damage that's happening. It accumulates, it doesn't go away on its own. The pathogens tend to multiply, they form stronger biofilms, and that can cause a lot of hormone disruption, causes symptoms to get worse, and eventually your vitality, your ability to kind of thrive through life declines. So again, think of this as an investment in your health, right? This triad of chaos, we're getting rid of parasites, candida, bacteria, viruses, anything that really is causing your body's inflammation to go crazy, which then is going to drive a lot of other things. Remember, chronic illness is all driven by inflammation, whether it's heart disease, whether it's stroke, whether it's type 2 diabetes, all these different chronic illnesses are driven by inflammation. And this whole process is really designed to remove that inflammatory process. So I'm going to go ahead and I'm going to stop sharing there, but I want to open it up to questions. Does anybody have any questions that kind of jump out at them? Um, Things that, they feel are going on with their life right now that pertaining to what we just talked about, does anything kind of jump out at you? Jennifer, I see you unmuted yourself. Do you have
Yeah, no,
questions?
I think it all looks great. I mean, and what you've done for Tom, my husband, has been phenomenal. So I think what I need is I can't be self-directed like this. I need to come in to see you and get on a plan, I think, because I think with my Lyme disease, it adds another layer of complexity.
Absolutely. Yeah,
Hmm.
no, he's doing great. And I know he was excited to get you feeling a lot better as well. So
Hmm.
I know we've
Yeah.
got something scheduled in about a month or so. I mean, you're always welcome to move that up as well to we can find an opening.
We're going to Florida for the month of
Oh,
February because I just think the sun is medicine. And I
well,
just want to,
being out of this cold is medicine for sure, right?
yes. Yes, exactly. So yeah, so it's right after we get back that
Okay.
we'll come and see you. So,
Well,
but
that's
thank
great.
you. Yeah. This is
Absolutely.
great. Yeah, awesome. And yeah, I look forward to meeting you and seeing what you can do for me. So,
Yeah,
thank you.
absolutely. Anybody else, any other questions, any comments or anything? Okay. Well, hopefully this brings a little bit of insight to you guys. Hopefully it helps educate you a little bit. If you have any questions or anything, feel free to reach out to us at Bluegrass Natural Health. Um, Alicia, I look forward to seeing you and Leslie, you as well at your next appointments. Sharon and Donna, I hope that you guys got a little bit out of this, and I look forward to talking to you guys soon. Okay? Have a good night, you guys.
Thank you. Bye-bye.